KCTV5 is your school authority. Carolina Cruz looked at the numbers in several local districts, and she joins us live outside of Children's Mercy Hospital. So, Carolina, what are these numbers telling us?
Well, Brad, there's just a different dynamic this year compared to last. Nearly every school had some sort of mask policy. Last year, well, that's not the case across the board right now, which is leading to some of those quarantines. The start of preschool this year hasn't gone as planned for 4-year-old Hazel.
She'd been home the entire pandemic, and we'd mitigated risk the entire pandemic, and she had just gone back to school. And so for me, it was, this is either a typical back to school virus, but not getting tested wasn't a choice.
Jenna Sutter-Brown says her daughter started feeling allergy-like symptoms one night and ran a fever by the next day. Hazel's test results for COVID-19 came back positive.
Well, every day just gets a little bit better. Her appetite's coming back. An occasional cough here and there, and not quite as energetic as usual, but she's more herself every day.
Children's Mercy Hospital is treating more than a dozen kids with COVID-19 as of Monday. The rate in infections is evident in school districts' COVID-19 dashboards. In Olathe, 99 students tested positive for COVID from August 20th to last Thursday. 318 kids had to quarantine because of possible exposure. The number of elementary students testing positive is double that of middle and high schoolers, and younger students are having to quarantine more often. Typically, these students are not old enough to be vaccinated. For teachers in Olathe, 15 tested positive and 34 had to quarantine in that 1-week span. Shawnee Mission School District's data from Monday shows 73 students and 12 staff are at home. Most exposures happened in the community. The Blue Springs COVID-19 dashboard reinforces that theory. It shows no cases are linked to school spread, yet 12 students have tested positive, resulting in 22 quarantines because of exposure at school. At Children's Mercy, the severity of disease ranges by patient.
It does vary. We've seen it in all ages, from newborns all the way to 18 plus. We have kids that get admitted to the hospital who have underlying conditions, but also kids that are otherwise healthy.
I'm not naive. There are false positives, and maybe she didn't have it. And so I'm going to treat it as such, that we still owe our community. And, also it's a lesson in authority. This is what you're being asked to do.
Jenna says she's glad she trusted her instinct to have her daughter tested and keep her at home until they received test results. She says otherwise, it could have led to more infections in the community. Dr. Angela Myers says if your child does test positive for COVID-19, notify their school immediately. This will help not only the staff, but also the health department contact trace and minimize spread. Reporting in Kansas City, I'm Carolina Cruz, KCTV 5 News.
Thanks, Carolina.